Good morning, everyone. Happy Saturday and happy Easter weekend. I hope everybody's it's relaxing this morning, and thank you so much for joining us. So today we have a fantastic presenter, Dr. David Garcia. David Garcia has practiced integrative medicine with regenerative medicine since 2006, so a long time. He was trained in family practice and also holds board certifications in emergency medicine, occupational medicine, and addiction medicine. He's with BodylogicMD and a nationwide network of integrative physicians with approximately 50 locations. So Dr. Garcia believes that there are out-of-the-box treatments and ways of thinking to increase your practice potential and added value to your time and services to your patients. Without further ado, Dr. Garcia.
Hello, everyone. Hi, I'm Dr. David Garcia. I want to thank Anna for everything she's helping with. She's helping with my exosome treatments and PRP treatments. I want to thank you, Anna, for everything. And thank you for introducing me to this webinar as well. I do want to say I've been with BodylogicMD since 2006. I started with Bodylogic back then. We were just doing bioidentical hormone replacement therapy. And also with nutraceuticals, and really to optimize our patients' lives. So I always considered that the cornerstone, the baseline for my patients to optimize their hormones, through testosterone, DHA, growth hormone, progesterone, or estrogen. And so it provides a fertile ground for all your regenerative procedures that you may perform in the future. You have happy patients then because you've optimized their hormones, and they feel good. They're in better mood. They're looking better, losing weight, more lean muscle mass, better skin thickness. And then you add a regenerative procedure later on, and then it's even a better fertile ground for that procedure to really take. So one thing that I had a problem with hormone optimization was that even though we optimized the hormones, we never got the full weight loss that we wanted. So weight loss is always a difficult thing. We could arrest the development of weight gain, but not lose the weight. So I added a structured weight loss program. This program was consistent over time, and it's successful when you follow the program. So this weight loss allowed even a better fertile ground for any kind of potential regenerative procedures in the future. And also, over and over, it also allowed a loss of the medication the patient was taking for any comorbid conditions they had, like high blood pressure or things, or secondary to obesity, diabetes, that kind of stuff. So over time, I did add PRP procedures to the practice. So we did PRP injections into the joints, into the tendon sheaths, and then we added the O-shot, which is a regenerative medicine procedure with PRP for the woman, and also P-shot injection into the penis to optimize performance there. And then later on, after finishing the stem cell fellowship, I joined the Cell Surgical Network, and we started using treatment with stem cells with adipose-derived stromal vascular fraction, and injecting joints and performing IV treatments with the stromal vascular fraction with great results. And then more and more physicians over this time, since 2006, more and more physicians are going into this regenerative medicine space. And so I just felt like I always had to be above the curve, right? Trying to add more value-added products and services, and to be ahead and be more valuable to my patients. And always trying to look for new options to patients, building my base at the same time adding more services. And so I was exposed to peptides, and this happened serendipitously. I was on vacation. Well, my wife had chronic abdominal pain. Now, we were on vacation in San Diego a few years ago, and she had more of a pronounced abdominal pain. And it took her out of vacation. She stayed at the hotel room for several days while I took my kids around this town. But when we came back, we took her to the emergency room, and she had cholestasis, and then she had a cholecystectomy. So she was cured, right? Well, she wasn't cured. She continued to have this abdominal pain, this boring abdominal pain, mid-epigastric. We had imaging studies done, ultrasound, MRI, everything was negative. We had lab results done, serum lab, everything's negative. As far as the surgeon was concerned, she was cured, but she wasn't cured. She continued to have this pronounced abdominal pain with this severe nausea that was getting more and more pronounced every day. She began to lose weight. She started at 118 and went all the way down to 92 pounds. And, I was looking at this day by day, like, oh my goodness, there's bony prominences everywhere. It's getting more severe. And she didn't want to eat and didn't know what to do. I mean, everybody said she was fine. So I took her to a functional medicine doctor, and she was treated with supplements, L-glutamine, probiotics, the standard functional medicine stuff. She was put on no gluten, dairy-free diet, and all this helped out minimally. Did not stop the weight loss, did not stop the nausea. There was nothing going on here. I started to think, well, am I going to have to raise my two boys up alone? So I did go to a conference, and it was one of my first conferences on peptides, and I was exposed to the gastrointestinal peptide called BPC-157. So it helps out gastrointestinal issues. I started her on BP-157, 500 micrograms, which is one capsule. It's a starting dose. And she was better on the first dose, which means she had no nausea and just felt better. And over time, and we both thought, oh, it's a placebo effect, right? So we stopped it, and guess what? It came back. We restarted it, it went away. So over time, we began with one dose, then we went to two capsules, then 3 capsules, and 4 capsules, and she got better, consecutively better. It was mitigating all the symptoms. One morning she was crying, and I asked, why are you crying? She said it's the first time in decades she had woken up without nausea. So it was dramatic to say the least. And she started to gain her weight back. She actually was better than ever. More lean muscle mass and back to normal weight. And so over a period of time, I said, okay, well, she's great now. Let's start to titrate down the BP-157. And we did, and symptoms came back. So we started back up again for several months, and it went away, and she was fine again. And then after a while, let's titrate it back. So we titrated back to the BPC-157, and symptoms came back. So now she refuses to titrate off the BP-157. She's on 4-day, which is 2,000 micrograms, which is beyond the usual recommended dose. And she's been on that for 3 years and never wants to stop. I think it's a lifelong treatment for her. And it's a life-saving treatment. I believe she was on her way out before BPC-157 came on board. And I don't want her to stop. She doesn't want to stop. Nobody wants her to stop. It was the only thing I saw that turned things around, because there was nothing else, no other treatment was going on. So that's how I was exposed to peptides. That's when it became real to me. This is something real going on here. It's not, there's nobody's blowing wind. It's serious stuff. And so now after that, I did start to offer peptides to my patients. And again, it makes my practice more attractive. It can make your practice more attractive. You can become the local expert on this treatment on peptides. And so it's something you can add to your practice to even make it, in this downtime, even more valuable to your patients. So what are peptides, right? Well, peptides are amino acids. They're proteins, which are short proteins. They're less than 50 amino acids long. Now, one thing I have to say about peptides, they're already in your body. They're like hormones. They're already in your body. It's that as you get older, they get less and less. And you start to feel it. So peptides are in your body, and as you get older, they get less and less. So you have less of the cell signaling that peptides do. Now, you can use these peptides alone, like BPC-157, or you can use them in combination with the peptides, and you can have a synergistic effect on anabolism. You can actually help things grow. So there's many different subtypes of peptides. There's peptides for growth hormone, growth hormone optimization. There are peptides for sexual function, multiple peptides for sexual function. You can take them subcutaneously. You can take it intranasally to work on to enhance your libido. They work centrally. There are peptides that are nootropics, which means they enhance memory and learning and cognition. And same peptides are used for traumatic brain injury. There are peptides that optimize GI function, much like I spoke around my wife, GI function with BPC-157. There are immune enhancer peptides that enhance your immunity, optimize your interferon and your T cells. And there are peptides for aesthetics. So you can use peptides in your aesthetic procedures to optimize. If you use microneedling with PRP for hair growth or facial rejuvenation, you can use peptides in addition to that to optimize your aesthetic procedures. There are also peptides for weight loss. But I have to tell you, nothing works with weight loss like a structured weight loss program. I just have to say that over and over because I'm such a big believer on that. You have to change your lifestyle to really keep enhanced weight loss over a period of time. So the most peptides I use in my practice, most common use peptides, this is my practice, I use almost every day, are the growth hormone peptides, which are CJC 1295, Ipamorelin, and Tesmorelin. So these are peptides which enhance human growth hormone secretion. So I usually use these on all my new patients, right? Because everybody is low or has symptoms of low growth hormone as they get older, and I start usually everybody on that on the first visit, or I recommend it on the first visit, I should say. And the BP1C157 is also a core gastrointestinal peptide. Not only does it work for gastrointestinal issues, it also works for tendon and ligament issues. So it's very much a regenerative peptide. Thymosin beta 4 is another peptide that works on an acute injury or status post surgery. Let's say somebody had surgery and you want them to heal and respond faster post surgery. You can give them thymosin beta 4. And then thymosin alpha 1 is my immune enhancer peptide. Again, this is my baseline foundational peptides I use in my practice. There are many other peptides if you want to expand out. There are many more, but these are core ones you can start with that really can make people happy, just these few. So I'll talk about growth hormone therapies, how to enhance growth hormone through peptides. So the reason I don't use growth hormone itself, the exogenous growth hormone, inject it into your subcutaneous tissue, is because, first of all, it's very expensive. And also, there's all kinds of there's a lot of legal hurdles. It's got to be prescribed for specific things like dwarfism and growth hormone deficiency syndrome. And you better make your documentation completely correct because it can be looked on negatively by your medical board. And I used to do this back in 2006 when it first started, but I just got more and more concerned about it over time. And then I just went to the peptides, the growth hormone releasing peptides. And so it makes me happier, helps me sleep at night, I should say. So that's what I use the peptides for growth hormone. So what does growth hormone do? I'm sure a lot of you know about this. It does increase decreases the muscle and helps your body encourage growth. It decreases visceral fat mass, lowers the risk of cardiovascular events, and also increases energy and cognition. So it is very much a regenerative hormone. Growth hormone was first described as growth hormone. They saw it in kids as they had actual height, that they increased in height, and that's why they call it growth. But as you get older, you stop growing, correct? So, but at that point, it becomes more of a regenerative restoration and restorative hormone. And my mentor, Ron Rothberg, it really should be called a restoration hormone, and that's what it is. As you get older, you have less and less growth hormone, and therefore you have less lean muscle mass, greater skin thickness, less sleep, all these negative things. So you want growth hormone in a certain level, not zero, right? And I do want to talk about this negative biofeedback loop that we have with growth hormone. That's very important if you're using exogenous growth hormone, because you bypass this whole feedback loop if you're injecting yourself with growth hormone. Now, when you inject yourself with the growth hormone, releasing hormone, the peptide hormones, you don't bypass this feedback loop. It shows this graph that hypothalamus secretes the growth hormone releasing hormone. Growth hormone releasing hormone attaches to the anterior pituitary to the receptor, and then that releases growth hormone. So it goes at a certain level. If there's too much growth hormone will come back and actively inhibit the growth hormone releasing hormone so that there's less stimulation on the anterior pituitary to release growth hormone. So there is a feedback loop that you can't have too much growth hormone because it shuts itself off. At the same time, there's another mechanism with growth hormone. When you have too much, it will go back and cause a secretion of somatostatin, which is growth hormone inhibiting hormone. It will inhibit the release of growth hormone by binding to that growth hormone releasing hormone receptor. So there is a natural protective device, a fail-safe, a biofeedback loop of reducing the amount of growth hormone. So then growth hormone goes to liver, and liver then converts the growth hormone to IGF-1, insulin growth, like growth factor 1, which goes distally to all parts of the body to help the effects of growth hormone distally. So the idea here is that if you use exogenous growth hormone, you bypass this protective device completely. You'll override this biofeedback loop. The biofeedback loop does not help out. Excuse me. So this shows the amount of human growth hormone that is reduced over age. So when we're young, we have tons of growth hormone. We're all happy and jumping around, ecstatic with life. And then over time, growth hormone drops, and this rejuvenated hormone is decreased. So we really want to optimize that human growth hormone to a more efficacious, restorative level. So I just want to talk about things that help stimulate growth hormone secretion. Well, if you have decreased blood glucose, so it can stimulate GH secretion. So if you have a good lifestyle, eating the right things, you have decreased blood glucose and decreased free fatty acids. So that's great. Any stress, excitement, trauma, exercise also stimulates GH. Also hormones like your testosterone, DHA, especially in women, and estrogen stimulate growth hormone secretion. So that's why a lot of times when I see patients whose hormones are very low, we optimize their hormones, and their GH also increases without treating them with GH. See that all the time. Deep sleep. So growth hormone is secreted usually after a deep sleep. These little spikes of growth hormone that occur after a deep sleep, usually phase 4 sleep. And if you don't have this deep sleep, you're not going to have this significant growth hormone secretion. And it takes a while to get to deep sleep. You just don't go to sleep and have growth hormone secretion. It takes a while to get to phase 4, and then you have that growth hormone secretion. So you need deep sleep for a while, and then you have that secretion. If you don't have it, you're not having that secretion of growth hormone. And then also what we're talking about here, in a little bit, we're talking about the growth hormone releasing hormone and the growth hormone secretagogues also stimulate growth hormone. And then factors that inhibit growth hormone secretion are, increased fatty acids, increased blood glucose. So it comes back to that lifestyle change, right? Like how patients eat right, exercise right. It sounds almost so basic, but it can be life transforming. A structured weight loss, structured program to really help them keep that lifestyle of low fat. Aging makes you have less growth hormone. Obesity comes back to that lifestyle, and illness reduces growth hormone secretion. And then low hormones, the hypogonadism, hypothyroidism, decreased growth hormone. If you inject yourself with growth hormone, exogenous growth hormone, it's going to suppress your growth hormone secretion. And again, it comes down to your sleeping. If you have a circadian rhythm disturbance, if you're working third shift, or you have a swing shift, you're not having that deep sleep in which growth hormone is secreted, and you're going to have issues with that. Okay. So the first growth hormone releasing hormone analog that I use, and I tend to recommend this across the board on first patient visit, is CJC 1295. So this is a growth hormone releasing hormone analog. It binds to the anterior pituitary and stimulates release of GH. And then you have the result releases a result of fat loss, increasing muscle mass, better sleep. And it all comes down to repair and recovery. And it's a long-acting GHRH, growth hormone releasing hormone analog. And I always tell my patients, give me at least 90, commit to 90 days. CJC 1295, you see the full effect of this usually within 90 days, 3 months. Please give me that time period to really have this have an effect before you say it doesn't work. So the dosage of that is 2,000 micrograms per ml, and it's 0.1 ml sub-Q, 5 out of 7 nights. So it's a very small volume you inject subcutaneously in the fatty tissue in your abdomen, using a BD syringe with a 30 or 31 gauge needle. virtually painless, very easy to do. And then, so I just want to talk about the very first growth hormone releasing hormone analog was Tesmorelin. It's first generation. Now, Tesmorelin was the last 25 amino acids of the naturally produced growth hormone releasing hormone, and but that only binded to the receptor, the growth hormone releasing hormone receptor, approximately 12 minutes versus CJC1295, which binds to 30 minutes. And so you have, if it binds longer, you have more stimulation of the anterior pituitary to make growth hormone, which is why CJC1295 is actually more preferred over Tesmorelin now. But Tesmorelin's still out there. So Ipamorelin. Ipamorelin is a growth hormone secretagogue, a growth hormone releasing peptide. It also helps bind to the anterior pituitary through its own secretagogue receptor on the anterior pituitary, and the dosage is exactly the same at 2,000 mics per ml, 0.1 ml sub-Q, 5 out of 7 days a week. So you have this growth hormone releasing hormone, which is a CJC1295, and you have the growth hormone releasing peptide, which is the Ipamorelin. They both help release growth hormone. So I tend to use these. I think you can have a synergistic effect if you use these both together. And this graph does show this. So on this graph, you see on the y-axis the growth hormone release, and on the x-axis is time after intravenous dose. So the orange line is injection after placebo. You would expect no increase of GH after placebo, and that's exactly what you get. You get no increase. If you use a growth hormone releasing peptide, which is the blue line, you have a little bump there with the blue line, little GH release. The yellow line is a little bump of the growth hormone releasing hormone, so you get a bigger bump of this growth hormone releasing hormone. And the green line is another growth hormone releasing peptide, and you have a bigger bump. So great. But if you use two of them in combination, the growth hormone releasing peptide and the growth hormone releasing hormone in combination, you can have 3 to 5 times increase the growth hormone. It's a synergistic effect, and that is the red line. So you really notice a big improvement where the sum is greater than equal. Well, I don't know how to say that, but you have better improvement over that with using both. So I use the CJC1295 Ipamorelin together. And this is, again, this is a core treatment program I give to my patients to really optimize their growth hormone. So these two together both increase your GH secretion, which increases IGF-1, which goes down the line, increases better sleep. Again, that cannot be overdosed because that biofeedback loop mechanism. It's part of that loop. It doesn't override it like exogenous growth hormone would. It's similar to Tesmorelin, but it's similar in cost, but it has 3 to 5 times better secretion and benefits versus using Tesmorelin or CJC or Ipamorelin alone. Excuse me. Okay, so another growth hormone releasing hormone is Tesmorelin. So remember I said that CJC1295 give me 90 days before you notice improvement. If somebody's not not as patient, you can offer them Tesmorelin, and you can see results within 30 days with Tesmorelin. But then you also have increased costs for that as well. So there's a give and take there. So Tesmorelin is also another growth hormone releasing hormone. It's been shown to really increase IGF-1 levels by 182 micrograms per liter on average. It does all the things growth hormone does: decrease visceral adipose tissue, increase cognition, reduces carotid intima media size. It's the most effective growth hormone releasing hormone currently on the market. So it's very good. But again, the downside, it's more expensive. And it does come like this. It comes 1 milligrams injected 6 out of 7 days a week. And this is how it comes. So that's how it is. Now you can also use Tesmorelin in combination with Ipamorelin. The same kind of philosophy as I did with CJC1295 and Ipamorelin. You can also use Tesmorelin with Ipamorelin and get even a more pronounced dose. So if somebody's impatient, you can say, give me 30 days. Let's see if we have a better effect using a Tesmorelin. And then once they're happy with that, you can convert them back to the CJC1295 Ipamorelin. So that's always a possibility. So let's go on to, so that's the growth hormone um, secretagogues and hormones that I use to optimize growth hormone. Now we'll talk about BPC-157. This is with a story I told you about my wife earlier, where she was, it was a turnaround for quality of life, maybe life, and was pretty dramatic, at least in our lives. So it's a 15 amino acid peptide, and it was discovered in human gastric juice in 1993. So, but there's a story I heard at the International Peptide Society when I was first learning about peptides, that Dr. Pavlov, you know, of Dr. Pavlov's dogs, where he rang the bell and the dog salivated because he knew a meal was coming. Well, he found a derivative of dog's gastric juice that nobody, when he applied it on, it healed. If he put it on ulcers, it healed. If he put it on cuts, it healed. Whatever he put it on, it was dramatic healing gastric juice derivative. So it's hypothesized that he actually found BPC-157, though he didn't know it. And I was telling this story to a patient one time, and he told me his grandmother told him that when he was a kid, have your dog lick it, because it would heal faster if it's licked. And then I told the story to my practice manager, Deidre, and she said her grandmother, her whole family from South Carolina said, have your dogs lick their wounds, they'll heal faster. And so maybe who knows, maybe this is BPC-157. I don't recommend having your dogs lick their wounds. I'm just saying it's interesting. And also, BPC-157 is not made from dogs' gastric juices or human gastric juices, now synthesized in the lab. So no concern there. So BP-157 is a peptide. It has no single effect. It has pleiotropic effects, which means that you can use it for multiple uses. And I should say this about BPC-157 and peptides in general. They want homeostasis, which means they will work until there's no more work to be done. They will work on something until it's over, healed, and then if there's no more, it won't overheal. It wants homeostasis. And you kind of say the same thing with stem cells or exosomes. They won't overheal. They'll heal to the point in time where no more healing is needed and it stops. It has its own wisdom. So I should say the mechanism of action is unclear. It is cytoprotective, BPC-157, and it's one of the few that's orally, you can also use it orally. It's bioavailable orally. Okay, so because it is made in gastric juice, it is stable in gastric juice. So the effects of BP-157, it is very anti-inflammatory. It reduces inflammatory mediators. It is neuroprotective. You can use it for TBI. There are multiple animal studies where they transected sciatic nerves, they reanastomose them, and then all of a sudden they have better axonal growth, better diameter of the nerve growth, better thicker myelin sheaths. So it was pretty dramatic using BP-157 post-injury. It's also angiogenic and increased vasculogenesis. So you'll have better repair to an area because more blood supply to an area. It does maintain gastrointestinal mucosal integrity. So you can use it for people who have any kind of gastric issues like IBS, leaky gut syndrome. And I use it for anybody who has anybody, if they have like GERD type symptoms, bloating, chronic diarrhea, chronic constipation. I will throw BPC-157, and I have to tell you, the vast majority of the time it clears up. So it does heal the gastrointestinal tissue, repair that, and also tendons and ligaments. So I tend to use it with the gastrointestinal issues, with patients who have those issues, and also anybody who has tendons or ligament issues. You can inject around the ligament of injury. Let's say you have a lateral collateral or a lateral epicondylar strain or a tendinosis. You can inject right above that tendon, and it will make that heal faster. Just in my experience. I have not used it in traumatic brain injury. I don't have that many traumatic brain injury patients. And so it does. It prevents gastric ulcers, improves gastric function, and it reduces inflamed intestinal epithelium, and you can use it by inflammatory bowel diseases. It also protects the liver. There's a study where rats were injected with a liver toxic chemical, But if it were post-treated with BPC-157, the ones that were treated, all of them lived. The ones that were not treated died. So it is very effective with that. So how is it used? Well, again, I use it for tendon and ligament injuries and also GI issues. And so it does increase type 1 collagen, which is the collagen in tendons and ligaments and also dermis of the skin. So think about it. If it helps the dermis of the skin, you may want to try to use it also with your microneedling with PRP if you do a facial set procedure. So it can also help out there. And then with gut, I tend to use 500 micrograms per day as the starting dose. And it says right here for 30 days. And so that is just a general rule. It's not hard and fast. It depends symptomatically on your patient. For example, my wife, she's been on BPC-157 at 2,000 micrograms for 3 years. She feels great. And it is a lifelong thing on her part. So the effects of healing, it does, again, treat tendon, ligaments, muscles, nervous system. Again, it does increase axonal growth. It also increases growth hormone receptors on the ligaments and tendons. So you have outgrowth of tendon fibroblasts and also migration of tendon fibroblasts. So better healing through growth hormone receptor optimization and increase. And also, you can use it to decrease pain in damaged areas. Let's say you have a muscle that's been strained, you can inject that muscle, just subcutaneously above that muscle and reduce pain with BPC-157. So that is a pretty amazing peptide. That is, again, a core peptide I use for anybody who has any kind of GI issues or tendon issues in my practice. And a dosage, 2,000 micrograms in a 5 ml vial is 0.15 ml sub-Q for 30 days or orally 500 micrograms every day. And that's the starting dose. Okay, BPC-157. The next one is thymosin beta-4. Now, thymosin beta-4 is a thymosin peptide made naturally in the body from the thymus gland. It is present in all human cells, but always found in higher concentration in tissue damaged areas. So it was known in the sports world for many years. It was used in sports doping about 20 years prior to decrease injury and also to increase performance. You have delayed onset of muscle soreness. So professional sports players would use it to reduce, increase recovery and use, and sort of be better, faster, longer. Just be better with thymosin beta-4 because it is a very much of a healing peptide. And so it's a actin monomer sequestering protein, which means it draws an actin to the area of injury. Actin is needed for a cytoskeleton repair of the injured area. So the injured area can be repaired with more organization and better structure. So it draws in the actin makes that cytoskeleton so you can have that repair occur with a type of organization. So it is naturally occurring in any kind of wound bed, and it is the first gene to be upregulated upon injury. And so you need it for repair, and it also reduces inflammation. Thymosin beta-4. Again, this shows that it is that actin sequestering protein. It also draws in myosin to create that cytoskeleton for healing around an injured site. It also promotes cell migration, cell proliferation, and attracts stem cells to the area of injury for better repair. So it also stimulates production of T cells, right? It is produced from the thymus gland after all. But its main thing, its role in protection and regeneration, protection, and remodeling of injured tissues. Thymosin beta-4. So I tend to use it. No, I think it's the next slide. I tend to use it with anybody who's had athletic recovery. Let's say you strained a muscle, strained a ligament, post-surgery or injury. Let's say somebody had a arthroscopy of a knee and they just want to be better, faster, and you want to build that knee up quicker, so you can inject subcutaneous around the knee with thymosin beta-4. Now, thymosin beta-4 also has been shown to increase hair. So you can also use thymosin beta-4 in microinjections with your microneedling technique with PRP or exosomes on the scalp. Now, it's been shown in studies that it does promote cardiac healing. You have less of the infarct size after an infarct has been promoted, traumatic brain injury, and reduces inflammation in the lung and cornea. Again, I use it for athletic injury or post-surgery. General dosing is 750 micrograms, which is 0.25 ml sub-Q daily. And they say do not use more than 3 months because it is angiogenic. And the idea is you don't want to promote too much blood growth if you have a cancer. You don't want to keep it going on forever. You don't want to promote any kind of potential cancer that's already there. It's not oncogenic, but you don't want it to promote something that's already there over a period of time. So that's the reason why I say no more than 3 months. And you could cycle that as well with other peptides. And you can also use it with other peptides concurrently. So thymosin beta-4, which is good for injury, right? And you can throw in BPC-157 at the same time, which is good for ligament growth and tendon health. Promotes growth hormone receptors on those areas. So both those together, and reduces pain. Both those together are they can be magical. Okay, so the next one is thymosin alpha-1, which is the immune enhancer peptide. And that is also secreted by the thymus. Remember, the thymus gland produces T cells, and that involutes as we get older. And so there's something called immune senescence. As we get older, our immunity is down. It's one of our markers of aging, and so no, that's not good. So you want to stimulate T cell production with thymosin alpha-1, and it helps B cells turn to plasma cells, and then you have antibody production. So it's an immune enhancer. So it inhibits viral replication. You improves CD4 counts, CD8 counts. It protects against oxidative damage. Also has anti-tumor effects. There is a medication approved in over 30 nations, not in the United States. It's called Sudaxine. It is thymosin alpha-1. It's been shown to inhibit and treat hepatitis B, C. There are some treatment potentially with HIV. It's been shown to use as a vaccine adjunct. It also has anti-tumor effects against small, non-small cell tumor in the lung, and also helps regulate and maintain glutathione in the body, thymosin alpha-1. Glutathione increases interferon, and which inhibits viral replication. So you want thymosin alpha-1. So it is a very good peptide. Again, it's good for a vaccine adjunct, chemotherapy adjunct, helps that, just makes it more efficacious if you use thymosin alpha-1 with it. It's a treatment for hepatitis B and C, and it's used as the Sudaxine in other countries. That's the trade name of the medication. But here it's peptide in the United States. It's very good for viral infections, and that's important in the world we live in now. So the dosage is 0.15, which is 450 micrograms, sub-Q daily. That's 3,000 mics in a 5 ml vial. Or you can do it every third day, which would be approximately 0.5 mL every third day. So that's very important for immune optimization. Okay. So I do want to talk about what's going on right now in the world, this COVID-19. What can we do to treat it from the perspective of peptides? And these recommendations were recommended by the International Peptide Society. They did say there was no double-blind, placebo-controlled study on this. This is just best educated guess using what we know for peptides to optimize our immune system against new viruses, right? And that's what this is. And I do want to talk, so the very first peptide for that is called LL37. And this is a very strong peptide. It will upregulate your immune system very strongly, and it's used for people who have been exposed or are symptomatic. So LL37, again, occurs in our body naturally. It's not something new we're adding, not something synthetic. It is stored in neutrophil granules as inactive precursors. So the neutrophils go to the site of infection, dump these inactive precursors, they turn into LL37. The scientific name for this is cathelicidins. And they have a role in first line of defense against infection at sites of inflammation, which means it's an innate immunity. So it's not specific immunity, it's your innate immunity. So it will upregulate your general immunity and cause inflammation at the site of infection. So you only want to use these only if they're actively infected. So it has a broad spectrum against bacteria, viruses, and fungi. mechanisms of action. It causes a pore in the viral wall, and so it disrupts the wall, basically, in a viral wall. And dose of that is 100 micrograms every day for 6 weeks. That's at 0.5 ml subcutaneously. Okay, so that's one peptide to optimize your immune function if you've been exposed. The other one is thymosin alpha-1, we just talked about, the immune enhancer. So you can use this for 3 months straight, and using that dose, I recommend it at the 450 micrograms every day. And then, but if you're exposed or have symptoms, you can triple that dose, the 1350. So for 2 weeks, and then go back down to the 450 micrograms every day to optimize your immune system. And then there is another peptide called Saline that the International Peptide Society has recommended to optimize yourself against viruses. And I've only put this on here because this has been recommended by International Peptide Society. In my mind, Saline is very good as a nootropic, which means it's great for memory and learning processes. You optimize your brain function with Saline, and that's how I use it. But it also has an immunomodulatory activity. Now, and the reason I put this on here is because International Peptide Society has recommended that, and so I put it on there. But the treatment is one spray in each nostril every day. Not each nostril, one nostril, and you rotate the nostrils every day. If you come down with symptoms or being exposed, a high exposure, then you can do each nostril every day for 2 weeks. So Saline. And then other treatments for your the viral illness with vitamin D. You want to optimize vitamin D. The International Peptide Society says 10,000 IUs. I do start my patients between 5,000 to 10,000 IUs every day. Most people are walking around vitamin D deficient or not in the optimal range. Probably 95% of the people you see there are not in the optimal range of vitamin D. 5,000 IUs vitamin D is not going to hurt them. Right now, it's going to be the greatest thing in the world. It's an easy way to really upregulate their immune system. It's vitamin D3, 5,000 to 10,000 IUs every day. And then ketone esters. So what are ketone esters? Ketone esters are a product of fat metabolism, right? So you can form ketone esters through starvation and also heavy exercise. And then it goes through, it can go through the Krebs cycle, form 2-acetyl-CoAs, and then form more ATP. So it's another way to upregulate your system by forming more ATP versus the usual glucose metabolism. So a lot of times people who have these comorbid conditions like obesity, hypertension, let's say diabetes, have problems with glucose utilization or efficiency. And so they need another way to really upregulate their immune system, upregulate the immune system through their ATP, and that would be through ketone esters. And so I'm not recommending that they exercise or starve themselves to death. I'm recommending they take the ketone esters that's been pre-manufactured in an oral form. You can swallow it and you're upregulated. So it's great for exercise as well if you want to do that with that. And I think I can say trade names here, right? I have no problem with that. But two great companies that make ketone esters are KetoneAid, and then Human, spelled HVMN. So they can upregulate your immune system by upregulating your amount of ATP production you have. And then there is a Chinese herb called dihydrohonokiol that it's been widely known as a anxiolytic type of Chinese herb. It is given 7.5 milligrams AM and night, and then if high exposure, then you double that to 15 milligrams 3 times a day. That's been shown to upregulate interferon and downregulate nuclear factor kappa beta. It's been shown to block hepatitis C, dengue virus type 2 infections by inhibiting viral replication, and also herpes simplex virus type 1, and there's studies showing some weak activity against HIV-1. So this is just a Chinese herb that you can use, but you can also may feel chill on it, because it's anxiolytic as well. Dr. Seeds, the founder of International Peptide Society, states that this quote-unquote crushes benzos. So maybe that's helpful, but it also upregulates your immune system as well. So I do want to say that, just to recap, if you want to add another revenue stream, be more valuable and attractive to your patients, and add greater efficacy to your regen procedures, I recommend adding peptides to your practice. So again, my baseline peptides are the growth hormone peptides, which are CJC 1295 and Ipamorelin and Tesmorelin. The GI / tendon and ligament peptide, which is BPC 157. The injury and status post-surgery peptide, which is Thymosin beta 4. The immune enhancer peptide, Thymosin alpha 1. And so, you can, and I suggest you may want to try one of these yourself. And the easiest one I think to try out is BPC 157. Usually, most people have patients have GI issues, or you can try it yourself. It's very easy to do. You take a capsule and try it on one patient. It's very easy, and you can have amazing results with that as well. If you want to dive deeper into peptides, and I have nothing to do with the International Peptide Society, I'm just trying to give you information so you can become better physicians yourself. I recommend checking out the International Peptide Society, the International Peptide Society. And they do have a conference coming up in July 24th, 25th. It'd be great to go there. I'll be there. I'll see you there. So it's very fascinating stuff. And I do want to thank TaylorMade Pharmacy for some of the info on these slides, by the way. So that is my webinar.
Garcia, thank you. It was a really informative presentation. I have some questions from the attendees.
Sure, go ahead.
If you don't mind.
No.
What peptides should I start with?
Well, you can start with like I said, the easiest one to do is BPC 157. That's the one I started out with. I just tried it out because there was no other option in my when I started my wife. But it's something you can try yourself. You can try it in some patients that you've tried your functional medicine therapies, and you've had some results, but really not truly efficacious or fully efficacious. You can throw BPC 157, just one capsule once a day, and start with one. When you start with one, you get more comfortable. Yes, it did work, and then you try other things as well. So I'd say start with BPC 157. In my mind, that's the easiest thing. Or you can try your growth hormone peptides as well, and people who are want to be more aggressive and increase growth hormone peptides. Usually that's the middle-aged male, in my experience.
Excellent. Thank you. How about peptide use in children? Any research?
Not well. Yeah, I would. There may be some research on that, not that I'm aware of. Now, I think there is some peptide use with nootropics in children for autistic purposes, but I'm not fully aware of that, and that's something I have to research. I can look into that, but I do not treat children, so there are some things with nootropics for children I have for in the past, but not that I'm fully aware of. I wish I could answer that more fully.
Thank you. The next question I have, what pharmacies can I use that provide services?
Okay, so with BodylogicMD, we do have vetted pharmacies that we use. And, now, some information given in for this lecture was given by TaylorMade Pharmacy. TaylorMade, that's Taylor, Tailor, Made, M-A-D-E, Made Pharmacy. They're in Kentucky. They are one of the first pharmacies in the country to be using peptides. And I also use Wells Compounding Pharmacy in Florida, APS Pharmacy. They are also in Florida as well. And I think Belmar Pharmacy is beginning to produce some peptides. Belmar, B-E-L-M-A-R, and they're in Colorado.
Thank you. Are all peptides mainly injections?
Most of them are injection. That's right, subcutaneous injection, right? Subcutaneous into the subcutaneous tissue. The only ones that are not are, BPC is also a subcutaneous injection, but can also be used as a oral capsule. And then there is another one, Thymosin beta 4 fragments, they call it, made by a company called Integrative Peptides, and that is also oral form. So that is also another resource, is a company called Integrative Peptides that makes BPC 157 and also the Thymosin beta 4 oral form.
Excellent. How about the use of peptides in aesthetic procedures? Can you touch on that subject, please?
Okay, well, you can use, like I said, the thymosin beta 4. Thymosin beta 4 is very good for hair growth. It's been shown to be very good for hair growth. So if you're doing microneedling with PRP or exosomes, you can throw in thymosin beta 4 on that. And then also the other peptides I have not talked about, GHKCU. GHKCU is a peptide that also helps optimize hair growth. So you can also inject that as well with microneedling procedure in the scalp for hair growth. It's very good for hair growth and also for skin, just skin rejuvenation as well. So you can also place that on a facial rejuvenation type of procedure. And so it's called GHKCU. It's a G and a H and a K and a CU, like a copper, C and small U. And Kittle does have that along with Wells Compounding Pharmacy also has that.
Great, thank you. Dr. Garcia, actually, I've heard of some physicians injecting peptides like for 3 weeks before the hair PRP and stem cell injection.
Oh, you did? Okay, great. I'm sorry, you didn't finish the question. What's that?
Do you know of any protocol that actually, when physicians do hair injections with PRP and stem cells, I've heard from some of them that they would inject peptides for like 21, they would ask patients to inject peptides for 21 days before the hair injection.
You mean into the scalp or like some just in the belly?
Mm-hmm.
Yeah, the whole idea behind that is that you're providing a fertile ground, right? If you're up-regulating your system, you're up-regulating, it's better. You want weight loss through, you want hormone optimization, and you can optimize your peptides before the procedure. I think it's great.
How long did it take you to learn the peptides? Like
I took a peptide certification course through the International Peptide Society. That course was probably over a year. Over I think 3 different times I went for the certification. But you don't need the certification course to start treating peptides. You can be guided. You can go to the conference. You can be guided by the pharmacy on one peptide. It was in short order. I was using peptides way before I was certified with DPC 157 and the growth hormone peptides. I just went right to growth hormone. I had been doing growth hormone peptides for a long time before I knew they were called peptides, actually.
Wow, that's impressive. Dr. Garcia, we have another speaker in a few moments, but I wanted to ask you, what do you do during coronavirus time and your practice? How do you ensure that you have a flow of patients right now? What are the tricks and tips you could give to our physicians attending this morning's webinar?
Well, that's a great question. So I think a lot of coronavirus is real, right? So you want to make sure you try to calm down the fears, and the fear is a big component of this. So I always say that we are doing our social distancing. We are cleaning between every patient. We're separating our patients before, so there's not too many patients in the lobby waiting. We try to separate them out and longer appointment times. And then also one big thing is that I am now offering more and more this immune enhancement therapies through peptides like TA1. Vitamin D and zinc. I'm just offering all the nutraceuticals to help optimize the immune system. So recently, last couple weeks, I've been really prescribing a lot of TA1 big time, and so your practice is more attractive, right? You are the go-to expert for this, and it's a value added products for your patients. They see you as indispensable in this time, and it's real. This stuff does enhance the immune system. So that's how I view what you can do now to really enhance your practice in this downtime. And also, you may want to consider doing some YouTube videos on your practice to really get the word out. YouTube is a constant free marketing for yourself while you sleep.
Yes.
So start making some YouTube videos.
I started on that. I know that a month ago you were not doing it, but now when I go on your YouTube channel, there is some action going on.
Yeah, so I started doing YouTube about a month ago, right? When all it started to happen, I started to look into it more, and I want to make sure there's no downtime, right, in my practice. So it's all about marketing and at the same time, not just marketing, but also having a treatment, something that actually works that people love, and they all come back to you, even this downtime. So,
Excellent.
Hope that answers your question.
Yes, thank you. Dr. Garcia, I have actually one more question going back to your type. One of the physicians actually would like to contribute some information. I don't know if you are aware of that.
Okay.
Are you aware that Tesmorelin is classified as a biologic and it's no longer available?
Oh, it's no longer available? Okay. Since when? Since recently?
Yeah, she says as of March 23rd.
March 23rd.
Yes,
so that's strange. I think they're still selling. I think they're still selling it. I think I did hear with I don't know if this is part of it, but TaylorMade. I was talking with the vice president of TaylorMade about this. They may try to add this, make this more of an investigative peptide, and so any patients that are on it or any new patients that want to be on it will be enrolled in the IRB program, and so it's an investigation. So they can be part of it. They just have to sign on to this IRB, and then to keep enrolled in IRB, you have to just do one blood spot test a year, which looks at methylation markers, biologic age, and it should show improvement. But that's how TaylorMade is looking at that, to try to get everybody involved in this IRB so that they can still continue to use that. So we'll see.
Excellent. Wow. I love your presentation. Thank you so much, Dr. Garcia. It was a pleasure to have you this morning, and
thank you. Good to be here.
Thank you.